Okay, doctor. And what's the difference between hybrid blepharoplasty and traditional blepharoplasty? So, there are several differences. There are a lot of details that are worth me sharing with you here. The first detail is that in hybrid blepharoplasty, I always assess the position of the eyebrow. I always put the eyebrow in the right place before working on the upper eyelid. And why is that important? Well, I see a lot of secondary patients in my office. I've mentioned this in other videos, and what do I notice? Every time patients have their upper eyelids done and they don't reposition, right? They don't put the eyebrow in the right place, so too much skin ends up being removed during surgery and the incisions end up being very long. I see patients with incisions that go almost all the way out here to the side of the orbit. And the more lateral the scar on the upper eyelid is, the less aesthetic it looks, so to speak, because it's not a place where we usually see a scar. And what else happens, right? Which is what affects my work. When too much skin is removed from the upper eyelid, in some cases, it makes it impossible to reposition the eyebrow. So I end up not being able to give patients a complete result. So in upper blepharoplasty, the best time to reposition the eyebrow is when you're doing the eyelid surgery. That's the first difference. Second difference, every time I remove the fat pads, right? The fat pads are those bulges that show up both on the upper and lower eyelids. You need to add volume back in, but in a different part of the eyelid. So, a lot of people don't understand, right? Why I remove the fat pads and then graft fat. Because the fat isn't grafted where the patient had the fat pad. The fat is placed somewhere else. There's a bony notch here on the upper eyelid that we call the A-frame, and it's right in the hollow that sits just below the eyebrow. Every time we remove the fat pad from the upper eyelid, and we don't fill in this notch, it creates a hollowed effect in the eyes, and hollowed eyes give people an aged appearance. So, getting rid of the hollowness, filling in the hollow, creates a rejuvenating effect for patients. That's why every time I do eyelid surgery, I graft fat. In my clinical practice, there's no such thing as doing a blepharoplasty without grafting fat around the eyes to fill the cheekbone area, to get rid of that sunken look under the eyes, to take away the hollowness, okay? So that's another difference between traditional blepharoplasty and hybrid blepharoplasty. In the traditional one, you only remove the fat pad. In the hybrid, you remove the fat pad and add fat in another area. Another very important detail is that I belong to the group of surgeons who advocate not weakening the muscles around the eyes. When we make the movement of opening and closing our eyes, right, we basically use two muscle groups: the levator muscle of the eyelid, which is inside and is responsible for opening the eyes, and the orbicularis, which is the muscle that closes the eyelid. When blepharoplasty is performed using the traditional technique, it's very common to either remove part of the muscle, right? Part of the upper eyelid muscle, which weakens the closing of the eyelid, or, right, the complete cutting of the lower eyelid muscle. And this also causes weakening of the eye closure. These small details in a patient, for example, between 30 and 40 years old, really won't make a difference in the function of the muscle. But in a patient who is 60 or 70 years old, this can make a big difference. Sometimes even for patients in their 50s. I've already had a 50-year-old patient who had functional logophthalmus, and it was due to weakening of the orbicularis muscle. Probably when she had her first eyelid surgery, when she had her eyelid done, the professional who did it, right, the plastic surgeon removed too much muscle, and then she ended up developing this muscle weakness over time. So I believe that the muscle should be preserved, so I don't incise and I don't resect the muscles around the eyes. That's another difference that I think is really important. It's a technical detail, but in the long run, it can cause lasting effects for the patient. Another important detail. Now, on the lower eyelid, in traditional blepharoplasty, the closer the incision is to the lash line, the better it's considered, and you remove the lower eyelid fat pads through this same incision that's made in the skin. In my opinion, this increases the risk of complications after surgery, right? Those are those misalignments at the corner of the eye, and also it interferes with the functioning of the muscle. How is it done in hybrid blepharoplasty the way I do it? I always remove the fat pads from inside the eye, so I don't cut this muscle on the outside. It's done with a technique we call transconjunctival. I make two small incisions inside here in this little hollow of the eye, and the lower fat pads are removed through there. So in this area, the muscle is not, let's say, violated, it's not injured. And the excess skin is not removed right up against the lash line. I don't believe in that either. I make lower incisions, and usually they're done where the patient has the most excess skin. I do tests, I assess where the patient has the most excess skin and only remove the skin that's left over. This technique is called low touch. And with this kind of approach, the incisions are really lower, but they heal very quickly. As a rule, in about 30 days, the patient already notices that the scar is fading. There's a technical detail I always mention here, which is that you should never leave the skin under tension. This is a basic principle of any cosmetic plastic surgery, of any procedure we're going to do. Every time you leave the skin under tension, it tends to heal in a more pronounced way to compensate for that excessive tension on the skin. And that's the main cause of hypertrophic scars, those raised scars, those scars that end up tight and pulled. I see this a lot in breast surgeries, in the abdomen, even in facelifts. Now, there's a group, right, of patients who have been coming to see us at the clinic, and these are patients who had facial surgeries done by non-doctors, and they show up with exactly these kinds of issues, scars from facial lifts. Yeah, every time you remove too much skin, every time the skin is left under tension, any reapproach or correction has to be very carefully planned. And it's not always possible to completely fix the after effects that the patient is left with. So that's another point I discuss a lot with patients. Ideally, you want to get it right the first time because trying to fix things, especially when the technique wasn't well done, is always harder, and there's always a chance that the damage will be permanent. You can make it less noticeable, but you can't fix it 100%. That's another very important detail. And the last difference between hybrid blepharoplasty and traditional blepharoplasty is how the skin is treated. Every time I give a lecture about this, I open the class with a slide of an iceberg. And that's how I see everyone's aging process. We don't age just in the skin, just in a muscle, just in the fat pads, or just in sagging. Aging is a combination of factors, and it involves exactly these three structures: excess skin, loss of volume, and the quality of that skin. So, to really create a natural rejuvenation effect, you need to improve the quality of the eyelid skin. And to do that, there are several options. We often use nano fat combined with some technology or skin treatment, which could be laser, could be biostimulation, could be peeling, could be Morpheus, or could be microneedling. And those are the main differences, right, between doing a traditional blepharoplasty, where you just remove the skin and the fat pads, and doing a hybrid blepharoplasty, which really creates a rejuvenating effect for people because you work on all the layers, right? All the effects of aging. Yeah, when patients ask me if they can just remove a little bit of skin, what I usually say is, do you want to look younger or more beautiful, or do you just want to solve a problem? Traditional blepharoplasty solves the problem, but solving a problem is different from enhancing the features of your gaze. So, to enhance those features, we need to use other tools. When you choose to undergo a procedure, you need to know what to expect from it. Each one has its place in the sun, each one has its own indication. You just need to know if the result you're going to get is the one you were expecting, so you don't end up with that dissatisfaction that can happen after surgery. Guys, that's it for today. It was a really interesting live. On Monday, I'll probably be back in the late afternoon, but every Monday we're going to do a live, either late in the morning or late in the afternoon. That Monday commitment. And if anyone has questions or doubts, whenever I see an interesting topic, I'll bring it here for us to talk about. All right? Have a great week, everyone, and see you next Monday.